said, "Do you want to address everybody?" I said, "I would, but I didn't have a microphone." But that whistle was pretty loud.
That worked.
Thank you. All right. Well, look, I want to say something about the Unmask Arkansas peaceful protest in front of the governor's mansion, and why we're all out here. In the interest of full disclosure, when I first heard about this COVID-19 thing, it's because a member of my family is an epidemiologist. She's very worried about it, so I was really concerned about it, and I was taking everything seriously. I was wearing a mask everywhere I went. I'd come home from the grocery store, I would spray stuff with my 70% alcohol solution because I was taking this seriously. I was looking at the worldwide coronavirus map several times a day, looking at the Arkansas Department of Health map of our state several times a day, talking about it on the radio, y'all, this is serious, got to be careful. The first thing that made me go, okay, wait a minute, was when a few months ago, New York State announced they're going to put 3,500 people on the death total, even though they didn't test them, because they were pretty sure they probably had it. I'm like, wait a minute, that doesn't make any sense. Why are you doing this? And then, come to find out that the CDC did a stealth edit of their website. Now, some people don't know what that means. A stealth edit is when you change your website, but you don't tell anybody. They did a stealth edit of their website saying, well, you know what? Turns out, after all, you can't really catch this from dry surfaces after all. Like, thanks for not telling 50 governors. What's that about? Right. And then one of the leading people with World Health Organization said, you know what? Asymptomatic people, you can't really catch it from them after all. I'm like, well, that's kind of a big deal. Of course, they had to walk that back a few days later, right? Which sounded kind of political to me. And then after the George Floyd died, by the way, of an overdose of fentanyl, we recently found out.
Chinese fentanyl.
And all these riots and all these protests, and you had a whole bunch of these healthcare professionals come out and sign a kind of like a manifesto. Okay, social distancing is important, but social justice is more important. Oh, okay. Right. So the people out protesting and rioting without masks, they're going to be okay because social justice is more important. Yeah. Look, I think if you're healthy enough to burn down a used car lot, you ought to be healthy enough to go to the grocery store or vote in person without a mask. But
tackle Kyle Rittenhouse.
But it's just been one thing after another, and then I found video of Dr. Fauci and the Surgeon General saying back in March, look, if you're healthy, please don't wear a mask. Right. So I had the outgoing director of the Arkansas Department of Health, Dr. Nate Smith, on in July, and I asked him about that. He said, oh, we've learned so much since then. And then tell me what we learned. Yeah. So more recently I found out the CDC in May said there's no evidence that masks stop the spread of influenza, which the Chinese communist coronavirus is, you know, an influenza. And the New England Journal of Medicine also said in May, outside of a hospital setting, masks really aren't going to do you much good. It's more of a psychological thing. So I wanted to have the new director of the health department on, Dr. Romero. Well, he's not available, period. How about the Surgeon General? Okay, I'll talk to the Surgeon General. Oh, it turns out he's not available anyway. Right. Why don't we give you the top epidemiologist? Somebody. So I asked her about the CDC and the New England Journal of Medicine saying in May, masks aren't any good. And she said, oh, we've learned so much since then. Right. I guess I'm going to have to email them and ask them what is it that we have learned. Yeah, right.
Please teach us, right?
Yeah, because the CDC director said a couple of months ago, well, yes, there is a financial incentive for hospitals, to count, you know, deaths as COVID related. Oh, there is. Yeah. And then you find out there's a New York Times article. That great right-wing publication, the New York Times, came out about 5 or 6 weeks ago and said, now this PCR test that's used nationwide, shouldn't be, because the PCR test is so sensitive, it can pick up some kind of viral artifact. You might have had the flu months ago, and they'll say, you're positive for coronavirus.
And they're having a lot
and so probably upwards of 90% of the positives in this country were false positives.
You underestimate my power.
And we're acting like that didn't happen somehow. It's just one thing after another. CDC